Good day and great health. My name is Dr. Jared Kosarka of Ohio Specific Chiropractic. I'm a pediatric, family wellness, and upper cervical specific chiropractor. Today on this video, I'm going to explain a little bit about the understanding of how we go about monitoring the nerve system as upper cervical chiropractors. The main way we're going to monitor the nerve system is through the analysis of skin temperature differentials. Now, you might be thinking to yourself, what does skin temperature have to do with the nerve system? Well, you see, skin temperature regulation is a direct reflection of nerve system function. That's because our nerve system controls our overall body temperature and its regulation. This is a physiological concept that's called thermoregulation. Our nerve system in general is the master control system of all the other organ, glands, and tissues of our body. It does four main things. It controls all the movements we make, it senses everything we feel, it regulates all our body organs, and it relates us to the outside world. Now, the two major ways that our nerve system is going to utilize the body to maintain thermoregulation is that it's going to distribute heat using the blood vessels, and it's going to dissipate heat using the skin. When we talk about heat, heat is going to be the natural byproduct of the creation of energy in the body through the process of cell metabolism. So anytime we have that process of metabolic energy being created, we're also creating energy as a natural we're also creating heat as a natural byproduct. Now, in order to distribute that heat throughout the body as evenly as possible, our nerve system is going to utilize our blood vessels to either open or dilate or constrict or close to pass that heat off throughout the whole body. We will ultimately have an excess amount of heat if there's healthy function. So in order to remove that excess amount of heat from the body, it's going to be sort of transferred to the surface or the skin where it can dissipate or radiate out of the body. Now, this is where we use our scientific instruments to scan the capillary beds, which are the small blood vessels that are going to be found in the skin, so we can then monitor that aspect of thermoregulation. We're not just going to scan any old spot on the skin, but we're going to scan bilateral points along the cervical spine and specifically the upper cervical spine. Now, why are we measuring bilateral points? We see the way our body functions is bilaterally. That's based on just in general the neurological makeup or the structure of our body. Our brain itself is in two halves. It's in right and left hemispheres. And all those nerves from those two hemispheres meet together at the brainstem, and then they travel down and form the spinal cord. And from that vertebral column that it houses and protects that spinal cord and brainstem, nerves will emit out in bilateral fashion to every organ, gland, and tissue of our body. So if we can scan a very proximal area that along that spinal column, we can get a pretty direct and relatively non-invasive observation of the nerve system and its function. By doing this, we can also be able to determine an abnormal or normal presentation of the nerve system at the spinal level and specifically at the brainstem level. Now, how do we determine what's normal and abnormal? Well, when we're trying to observe normal temperature readings, what we're really looking for is a normal temperature range. And within that range, the temperature should be continually changing. When we see that continual change within a temperature range, this is what we call adaptive. This is an adaptive process. Adaptation is a hallmark characteristic of homeostasis, and not just any homeostasis. I like to call it dynamic homeostasis. Often when we think of homeostasis, we think it's this sort of stagnant set point that doesn't move. But in actuality, homeostasis is very dynamic. That's because of the adaptive quality or characteristic of it. When we see this dynamic homeostasis, this is really an expression of health in the nerve system. Now, how does that look? How does that present itself in our scans? Well, when we take our neurological scans, or using our to determine skin temperature differentials. The major instrument we use is called a K4 neurocalligraph. When we scan up the spine, it gives us a readout or a printout of that skin temperature differentials as we measure up the spine. There are two major things we should see in a normal temperature reading. We should either see a straight line indicating that the body is in balance, or we should see something different each time we take the scan, which is indicating that the body is trying to find its balance. Both those are indications of dynamic homeostasis or health. Now, what's that look like with an abnormal temperature reading? Now, if there's abnormal temperature readings, that means that there's going to be a static temperature condition. That means the temperature isn't changing to, it's not fluctuating or it's not adapting. If it's not adapting, the process is maladaptive. That means it's not adapting to its greatest potential. This is what I like to call patterned homeostasis. This means that the body is still trying to find its balance, its homeostatic balance. It's still trying to search for health, but there's some type of stuck pattern happening, or there's some type of disruption or interference happening in the body that is not allowing it to reach its full potential. If there is a patterned homeostasis presentation, or if there's a stuck state in our neurophysiology, this is really an indication of, this is an expression of sickness, not a full expression of health. Now, what does that look like with our scans? Well, again, as we use our instrumentation and we get our readout, what we'll see is every time we look to that skin temperature differential, we'll see a similar pattern presenting itself every time we take the scan. That means that there is some type of static temperature presentation happening. That is strongly correlated with what we're trying to correct in chiropractic, which is the vertebral subluxation. Now, what's great about this instrumentation is it allows us to observe the nerve system in a really direct but non-invasive manner. So this allows us the understanding that there is some type of neurological interference happening. We use our instrumentation along with other analysis tools, specifically our radiographs or x-rays, to help us determine the structural or osseous presentation of that vertebral subluxation. And then we sort of couple that along with our neurological scan findings, and that helps us determine the where and the when of the vertebral subluxation, so we can better correct the vertebral subluxation, or the how, through our specific adjustment. Once we then correct the vertebral subluxation with the specific adjustment, this skin temperature differentials allows us then to monitor post-adjustment to see if we've actually cleared out or removed that maladaptive or that pattern state of homeostasis occurring at the brainstem level. Now, this is just a kind of a quick primer into some of the reasoning behind why we go about looking or observing skin temperature differentials. But if you have any other questions concerning this or just chiropractic in general, please don't hesitate to reach out to me on my website at ohiospecific.com. Thank you very much.